Imagine this. Have you ever felt like your body's plumbing is failing you at night? It's like it's slowing down drip by drip. Those nighttime bathroom trips getting annoying. Maybe your flow is weaker, or you constantly feel like you haven't fully emptied your bladder. It's disruptive, it's uncomfortable, and you might think it's just how it is when you get older. You've probably heard a lot, maybe even dreaded the thought of heavy medications. But there's a way to tighten that valve again. What if there was one simple exercise widely recommended by top doctors that could truly change your prostate health, improve urinary control, and even boost intimate confidence after 60? A straightforward, effective tool that costs you nothing but a few minutes a day. Today, we're cutting through the noise to share that exact exercise. As a urologist, I've seen its very powerful, positive impact firsthand. This isn't about grand promises. It's about giving you a proven, actionable way to feel better and more in control right now. And honestly, this one exercise could genuinely enhance your daily life. Stick with me because understanding why this matters so much for men like you is the first step to discovering this specific solution. So make sure you stay with me until the end because I'll show you how to do this exercise correctly for the best results. Welcome back to Vitality Health 101. I'm Dr. Freya Parkar. Here, we empower men at every stage of life with honest, science-backed insights for a more vibrant, confident existence. We truly understand that past 60, concerns about prostate health and daily vigor become significant. It's easy to believe a decline in these areas is just part of aging. But I'm here to offer a different, more empowering truth. You can actively support your body's natural resilience. Today, we're talking about the #1 exercise doctors recommend for prostate health after 60. We're going to explore what this seemingly simple practice involves and why its impact is far greater than you might imagine. So if you're nodding along right now thinking, that sounds like me, then you're exactly who I'm talking to, and you need to hear what's next as we break down these common challenges, because the exercise I'm about to reveal tackles these issues head-on. So, you're here because you're looking for a solution, and I've promised you one simple exercise doctors recommend. Before we unveil it, let's quickly underscore why it's so vital. You're noticing changes in your 60s, right? Perhaps it's frequent nighttime bathroom urges disrupting your sleep, or a weaker urinary stream leaving you feeling unfinished and anxious about restrooms. Honestly, these aren't isolated issues. They're often interconnected physical changes quietly chipping away at your energy and freedom. Understanding these links is your crucial first step to truly feeling better. Let's look at key challenges. Often see, the natural growth of the prostate, or BPH, can constrict the urethra, causing that weaker flow and incomplete emptying. Then there are weakened pelvic floor muscles, vital for bladder support, which can lead to dribbling and reduced control. These issues then directly cause disrupted sleep cycles, leading to fatigue and brain fog all day. And inevitably, these physical concerns can profoundly impact your confidence, affecting intimacy and your willingness to engage socially. These issues can genuinely make you feel like you're slowing down, frustrated, self-conscious, even less willing to do things you used to enjoy. You're certainly not alone. But here's the important part, gentlemen. What if an exercise you've perhaps heard of, maybe even dismissed, is actually the precise doctor-recommended solution to tackle these very problems at a fundamental level, transforming your urinary control and vitality? This isn't just about temporary relief. It's about lasting improvement. And the name of this powerful exercise, often overlooked by men, is now Hold On. You might be thinking, Kegels? Aren't those for women? Or I already know about those. And that's exactly why many men miss out on their incredible benefits. The truth is, the male pelvic floor muscles are absolutely vital. They support your bladder and bowel, aid continence, and significantly contribute to sexual function. From ancient wisdom to modern urology, strengthening this muscle group has a long history of effectiveness. In fact, a 2019 study in the European Urology Journal highlighted how consistent pelvic floor exercises notably improved urinary control in men dealing with prostate concerns. So, while the name might sound familiar, understanding why it's the #1 recommendation for men over 60 and how to do it correctly is where the real power lies. Let me explain exactly how strengthening these specific muscles creates such significant benefits for your prostate health and overall male vitality. You'll be surprised by the science. So, how exactly do these simple Kegel exercises work their positive magic for men's prostate health and overall wellness after 60? The real power comes from their direct impact on your pelvic floor muscles, creating a whole chain of noticeable improvements. Let's break down how consistent Kegels can truly help you improve your control. First, you'll experience enhanced urinary control. Kegels strengthen the hammock supporting your bladder, providing better support and a stronger seal around the urethra. This translates to improved bladder control, reducing frustrating leakage and urgency. You might also see reduced BPH symptoms. While Kegels don't shrink the prostate, strengthening surrounding muscles can optimize urine flow and promote more complete bladder emptying, easing many frustrating BPH symptoms. Importantly, we often see improved intimate function. A strong pelvic floor is crucial for both erectile function and ejaculatory control. By increasing blood flow and strengthening these muscles, Kegels can contribute to firmer erections and enhanced sexual pleasure and confidence. And crucially for daily life, you'll benefit from better, more restorative sleep. By significantly reducing those disruptive nighttime bathroom trips, Kegel directly lead to longer, more uninterrupted sleep, meaning more energy and sharper mental clarity. And when these benefits stack together, it feels less like you're managing a condition and more like you're getting your freedom back. Consistent practice makes these Kegel a key part of your self-care, supporting significant physical and emotional improvement. Now that you understand the why, let's get into the how, the simple, correct steps you can take today. All right, let's get practical. Here's the simple yet very effective way to identify and consistently incorporate Kegel exercises into your daily routine for better prostate health and overall wellness. The key, as with any exercise, is proper identification of the muscles and consistent execution. First, you need to identify the muscles. I often call this the stop P test. The easiest way to find your pelvic floor muscles is to try to stop your urine flow midstream. Those are precisely the muscles you're looking for. Important caveat, use this method only once to find the muscles. Do not practice by repeatedly stopping your urine, as this can irritate the bladder or lead to incomplete emptying over time. Another helpful way, imagine you are trying to stop passing gas. The muscles you use to pull inwards and upwards without moving your buttocks or thighs are your pelvic floor muscles. It's really important to remember, do not use your stomach, thigh, or buttock muscles. This is a subtle internal squeeze. And finally, always focus on consistency and breathing. Breathe normally throughout the exercises. Never hold your breath. Consistency is paramount. Just like any muscle in your body, your pelvic floor needs regular training to build and maintain strength. So, here's your daily challenge. For the next 2 to 4 weeks, commit to this simple ritual. Observe how your body responds. I think you'll be genuinely pleased by the revitalizing changes in urinary control, comfort, and even intimate sensation. A small, consistent commitment really can lead to big, lasting improvements. Once you've confidently identified them, it's time to practice the basic squeeze. Contract those muscles. Hold for about 3 to 5 seconds, then relax completely for another 3 to 5 seconds. Relax fully between reps. Over-bracing can backfire. Focus on an up and in squeeze as if you're gently lifting something internally. You can find your position that's most comfortable. You can do Kegel lying down, sitting, or even standing. Many men find it easier to learn while lying down initially, but with practice, you'll be able to do them anywhere for a recommended routine. Aim for 3 sets of 10 to 15 repetitions per day. The beauty of Kegel is you can easily break these sets up throughout your day, perhaps during your commute while watching TV or even waiting in line. They are completely invisible to others. And finally, always focus on consistency and breathing. Breathe normally throughout the exercises. Never hold your breath. Consistency is paramount. Just like any muscle in your body, your pelvic floor needs regular training to build and maintain strength. So here's your daily challenge. For the next 2 to 4 weeks, commit to this simple ritual. Observe how your body responds. I think you'll be genuinely pleased by the revitalizing changes in urinary control, comfort, and even intimate sensation. A small, consistent commitment really can lead to big, lasting improvements. And here's a fun way to keep each other motivated. After you've learned this exercise, drop the word Kegel in the comments below. That way, I know you've made it this far, and it gives me the push to create even more videos to support you. Now, while the direct benefits for prostate health and urinary control are very powerful, the positive power of a strong pelvic floor extends even further. It's not just about what happens down there. A strong pelvic floor is fundamental for enhanced core stability, balance, and better posture, supporting your spine and reducing strain. Beyond that, it greatly aids in improved bowel control, helping to prevent incontinence and supporting healthy movements. And of course, the better, more restorative sleep we discussed earlier boosts your overall recovery and mental sharpness. So, by adding Kegel, you're investing in a comprehensive upgrade for your entire body, enhancing physical capability and critical overall vigor. And if you're still wondering if this really works, just wait until you hear Frank's inspiring story. It's a powerful testament to what's possible. Let me share a truly inspiring, concise story about one of my patients, Frank. Frank, a 68-year-old retired engineer, came to me frustrated. He loved golf, but frequent urges and a weak stream made every round stressful. His sleep was constantly broken, leaving him exhausted. He felt like his body was giving up, affecting his quality of life and even his confidence with his wife, Susan. After just 2 months of diligently doing Kegel exercises, Frank's transformation was remarkable. He beamed during his follow-up. "Doctor, I'm sleeping through the night again. My stream is stronger and I don't feel that constant urge. I'm back on the golf course feeling like myself again." And Susan says, "I'm like a new man." Frank's story and many others show the real control you have over your own vitality through consistent action. Feeling your best self is absolutely within your reach. While daily Kegel exercises are a powerful natural tool for urinary control and prostate-related symptoms, it is absolutely vital to consult with your urologist or primary care physician immediately if you have persistent or severe issues. This includes chronic pain, blood in your urine or semen, severe erectile dysfunction, any unusual lumps, unexplained fatigue, sudden cognitive changes, or any other concerning physical symptoms. These strategies are supportive tools, not a substitute for professional medical diagnosis or treatment for underlying conditions. If you experience chronic pelvic pain or have symptoms akin to prostatitis, please consult a pelvic floor physical therapist or your urologist before starting Kegel exercises. For some individuals, over-tightening the pelvic floor can actually worsen these symptoms. Your doctor can assess, test, and ensure you get the most accurate diagnosis and safest, most effective care, working with your proactive changes. Please never let embarrassment or fear prevent you from seeking this vital care. Your well-being, peace of mind, and happiness are too important to neglect. Your health is an investment, not an expense. Your journey to lasting urinary control, renewed confidence, and a vibrant life can start right now with this simple, powerful daily action. Don't let unanswered questions limit your potential. This is about taking back your comfort, your independence, and your deep connections for yourself and for those you love. Take action today. Identify those pelvic floor muscles and commit to that daily Kegel routine. It's a small, tangible step to support your body's natural strength. If this video has brought you clarity or hope, please take a moment right now to hit that like button. And don't just keep this to yourself. Share it with a friend over 60 who might really need this. It genuinely helps us know we're delivering content that resonates. And to never miss out on trustworthy men's health advice from leading experts, all designed to empower. Men, please hit that subscribe button and ring the notification bell right now. Share your honest questions or experiences below in the comments respectfully. Your insights help others in our supportive community. Thank yourself for investing wisely in your well-being. Remember, your vitality is not just your legacy. It's your gift to the people who love you.